Greetings. I hope you are doing fine today. I would like us to discuss a little bit about mental health issues. It's still a very important and urgent topic, human development topic that is of utmost importance within our organizations, within the workplace. So sometimes the workplace, the way it is organized, can contribute to our mental health, but on the other end, can contribute to us having mental health issues. So I'm addressing to decision makers. I'm addressing to leaders. So it's really important for you to allocate resources to resources, for example, department of your organizations, but also to all the council of your organizations, I mean the board, the executive board of your organizations, to allocate resources for your employees, for your collaborators, for your co-workers, for your partners, to discuss and have specific programs and projects and initiatives with regards to mental health at the workplace, because it's becoming an issue worldwide. Mm? The WHO says that, for example, depression is one of the main causes of death. Uh, it is still, of course, we had pandemic, etc., etc., but depression is one of the key, motivation to death, to suicide. Suicide is another issue that one must take care, but take real care. It's true that it's not that pleasant sometimes to talk about these topics because they are tough. They are very huge. In terms of responses that we give or we have available or don't have available, and like that we need to create those responses to make it available to our employees, collaborators, etc., etc. It is a huge conversation as well because he tackles sensitive and emotional and individual, personal issues, but it's really important. I would like to say that mental illness is becoming a global public health issue, and we must take care of it as it is a public health issue, a public health phenomenon. So responses are so important. They gotta be there. And if when addressing mental health, if we commit some errors here and there, that impacts the global package of services that we must put available to our employees and collaborators. So more and more I recommend that we allocate resources to put in place, to make available programs, but real programs, sustainable programs of mid and long term, not only campaigns. I have the feeling that um, the World Mental Health Day, we do a lot of initiatives and campaigns, and they die the day after. So I recommend that we allocate resources, and once again, insisting in this, because I know it's a matter of resources, it's a matter of funds. Why not a global fund as we have for combating tuberculosis, malaria, HIV, etc.? Why not a global mental health fund? Hmm? A global mental health fund, because people are committing suicide, people are so depressed, that people are having a lot of issues in terms of the of mental health issues That is, and we need people to be, you know, sane. We don't need insane people. Of course, we need them, but they won't, you know, resist if we don't. It's not only a matter of giving them medicine, pills, 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 pills. No, pills are so important, of course. Chemical treatment is so important. Definitely, pills should be available, but at the same time, recruit social workers, psychologists, psychotherapists, mentors, coaches, people that went through a mental illness as well, to give their testimonials about how they are, coping and overcoming crisis, for example. It's not only a matter of, of course, nurses are so important as well to be recruited, all the health sector, professionals, but also social workers, social professionals, sociologists, anthropologists, lawyers. You know, treating the mental health issue is a matter of us working on networks, of us working on networks, because it's not only a doctor issue or a social worker issue. It's a societal issue, is a political issue, and of course an economical issue. So I insist on a, you know, global fund on mental health illness prevention and treatment. Of course, treatment, because it's not only a matter of preventing, but it's a matter of having available treatment for those people that are going through mental health. And just think about it, leader. Just think about it, decision maker. Don't you have someone in your family that is going through a mental health issue? I'm sure you have. And if you don't have, you will have. And if it's not happening to you, you don't know if it will happen to you, after all. So pay attention to this. It's a serious issue because, you know, it's an issue that it belongs to me, to you, to all of us. Just think a little bit about it. So a global fund, and a global fund that is available to in developing countries. To developed countries is true, but mainly to in developing countries, to those countries where, for example, people facing mental health issues don't have access to psychologists at the public, hospitals, for example. They don't have funds to go to a private clinic, to a private, hospital, to a private health center. So these details, I sometimes have this feeling that we are, um, failing in small details, and it's an issue to be addressed, to be discussed at all the high levels, not only WHO, but for example the UN system as a whole. Yes, yes, the UN system as a whole, for example. Not only the UN, but all the multilateral organizations, bilateral organizations, pay attention to in developing countries. So this global fund for mental health that should be available to in developing countries. I'm sure it's an action that can help a lot our communities around the world, because at the end of the day, sanity is so important, but we are becoming more and more insane. Why is that? Why is that? Due to stress, due to lack of human rights. This is a human rights issue as well. So lack of services, basic services available. You see how developed based this mental health topic is. So let's pay attention more and more to these stuffs. I thank you for your attention.